Good morning. It's the 5th of March, and this is the IEMT Q&A with me, Matt Kendall. If you have any questions, please do put them into the comment section, and I'll do my very best to answer them during this session. I am looking at several different screens at the moment because it is shared in lots of different ways. But hopefully, if you put a comment, I will see it. I know some people are watching. So first of all, thank you for being here. There wasn't a Q&A last week because I was away, but there's one this week and there's one every week going forward. I don't think there's any of the reasons why there wouldn't be one at the moment. Not until April anyway. So the rest of March, we are here right until the end of April, actually. Okay, so let me look at some of these questions. I have put them into the comment section for you, but let's look at these today. Is there a specific template or specific questions for IEMT clients for written or video? So this is for doing testimonials. So when I do a video testimonial with a client, which I have done a lot of, it's a conversation. It's a structured interview, but it's a conversation. Now, what I want to be asking the client about is what issues were they suffering with beforehand? So what issues were they suffering with? Was anxiety, depression, whatever it might be? What issues were they having beforehand? Secondly, what are the therapies they'd tried and what kind of results they'd already gotten from different therapies? Then I'm going to ask them how they found out about IEMT and or how they found out about me. Because sometimes people come to me because they find out about IEMT, they Google IEMT, they find me, or somebody's worked with me and referred them or recommended me and they've Googled me rather than IEMT and they don't have any idea what IEMT is. So I want to know all this information because when somebody's sharing this information, it's going to resonate with people who are watching. You've got to remember the content I'm creating here is for the person who is watching, your potential clients. So you want to be able to kind of pace their reality. So I was struggling with anxiety. I tried loads of different things. I tried medication. I tried CBT. I'd been for counselling, um, and then I wasn't really sort of getting any results. And then I started Googling about sort of PTSD kind of treatments, and I saw a video of yours come up on YouTube, and I saw a demo you did with a girl, which I found really interesting. So I started watching more and more of your videos, and then I went on your website and read your information, and then I emailed you. That's the kind of stuff that I'm really kind of looking for there. So what were your issues? What are the therapies had you tried, and what were your results like? How did you hear about me and slash IEMT? And then we're going to go into what did you think of the sessions themselves? So how were the actual sessions for you? So what did you think of the sessions? And then how has your life been since? So how has your life been since we did the sessions? So those are all the questions I'm going to ask. And again, it's a conversation, and I tell the client in advance, these are the questions I'm going to ask you. So if you can please think about the answers, because there's nothing worse, and I've had a couple of these, where you ask somebody, we go, so all right, so what were you suffering with beforehand? Anxiety, okay. And have you tried anything else before? Yeah, therapy. And how did you hear about me? Google. And it's just like one word answers, and it's not really any use to anybody. So the more interviews you have with clients, the more you can show them to the people who you want to interview. So you can say, look, this is the kind of interview I want to do with you. And my interviews with clients go from 15 minutes up to, I think, an hour. So they are quite in depth. So not everybody's suitable for this. Not everybody will want to share their story. Now, sometimes people don't want to go on camera, so you can just record an audio and put up a slide. That's very easy to do as well. So I hope that's some help. Is IEMT effective for treating anxiety and depression? And my first answer for this was IEMT doesn't treat anything, but it can help with memories, emotions, and identity related issues. And his response was the next question, okay, but anxiety and sadness are unwanted emotions. So we have to be very careful in IEMT, what we claim IEMT can and can't do. We don't actually can claim it can do anything, really. We don't say it actually treats something. What it does is it works with a person. And people have feelings, emotions, memories, and identity issues, and also this chronicity of why things haven't gotten better yet. So we don't specifically say it works with anxiety, but when somebody comes to me with anxiety, I'm going to be looking for the undercover or the underpinning emotions of anxiety using the 3 pillars and using some other stuff to try and help resolve the anxiety, but it doesn't treat anxiety specifically. And depression, it's the same thing. Now, depression, being clinically diagnosed with depression, seeing a psychiatrist and stuff like that is very different to somebody not liking their life and saying they're depressed. They are two categorically different things. Um, if somebody is clinically depressed under care of under psychiatric care, I don't get involved. That's nothing to do with me. Somebody who doesn't like their life for whatever reason, and they've got things going on they want help with, then yes, there's a good chance I'm going to be able to work with that person. So IEMT doesn't specifically treat anything. What it does, it works with people who have got memories, emotions, identity related issues by using a set of tools and techniques that often work very well. I'll be interested to know how the sessions go, as I would like to offer a session, someone with emetophobia. I think I'm pronouncing it correctly. Emetophobia. I'm just going to double check that that's the fear or phobia of being sick or seeing somebody being sick. I'm pretty sure. Of vomiting, seeing vomit, or witnessing other people being vomit, right? Yeah, okay, I thought it was. Emetophobia. So it's about people being sick. And sorry, my house phone's going. Hopefully somebody will get that. So the thing is, you can have 2 clients and they can fill out a form going, I have emetophobia. I don't know why they have that accent, but I have emetophobia. And but they have 2 completely different sets of issues. So one person, it could be about for them being sick in public. It's something which has happened to them or they've seen happen and now they're worried about it. And for somebody else, it can be about other people being sick near them. So first of all, what we have to do is we have to work out what's going on with this client. What's the problem? I have emetophobia. Okay, that's nice. You got yourself a label. What's the problem? Well, I just, when I'm on public transport, I have this issue where I think I'm going to be sick. Okay, we're starting to get somewhere. Tell me about that. What's the problem? Well, if I'm sick, everyone's going to stare at me, and I'm not going to be able to clear it up. I'm not going to be able to. Okay, right, okay. So we start to pull out of the client. Although we don't use much content, we still need to know how the problem is structured. So the stuff which we're pulling out of them is not necessarily stuff that's happened, by the way. It's just that the symptoms that they're suffering. And they are kind of 2 different things. One's the story, one's the actual stuff that I need to extrapolate that I can actually begin to work with. So I have worked with people with emetophobia before, and I had this one girl who was so phobic, had a very strong phobic reaction to people being sick well, people being sick near her. So she was working in a nighttime industry, entertainment industry, and she would take a lot of night tubes and a lot of night buses. And she had seen a lot of people being sick near her, on her, by her, and quite rightly so. She's developed quite a phobic response to this happening, and it was stopping her going into work, it was stopping her getting, so she was paying for taxis and stuff like this. Now the thing is, because of where she was and what she was doing, it was quite likely to happen again. And there's different things. If you've got somebody who's got shark phobia and they don't go swimming, what's wrong with you? But when you've got something like this and something which they're going to come up against, so it's okay. So tell me about the problem. Well, it's about seeing somebody being sick, and what's that like? It makes me feel disgusting And it's hearing that noise and that smell that really affects me, and it makes me want to be sick. And if you were sick, then it would be even worse. So what I'm starting to do, I'm actually starting to pull out the experience, the apprehensive anxiety about the thing, and some specific negative emotion memories that have already happened. And so there was a few times where she'd been seen people being really sick and stuff like that. So we worked on those memories. We worked on the emotions it evokes, and we worked on the imprints of those. And it was okay. What she started to notice, she could begin to start to see when somebody started to look a bit queasy, and she would get out of there as quickly as possible. Okay, so she would actually remove herself from the situation. So her emetophobia was causing her to not want to go onto public transport past midnight. Now, she didn't finish work till 2 or 3 sometimes. She was working in clubs and stuff. So with emetophobia, again, break it down. What's the actual thing that they're responding to? What is the emotion that it evokes? Again, because everybody can be different. And then use the K pattern. Okay. Anyone know if vertigo is aggravated by eye movements? I'm putting down to coincidence. I've never heard of vertigo being aggravated by the eye movements. The only time where I've heard vertigo or any feelings of nausea or dizziness is in the session or just after the session. And that's when people are doing too many eye movements. They're doing too many. In IEMT, we're trying to do the fewest eye movements possible. So we're actually trying to do oh, I've got my screen there. The fewest eye movements possible. It's not like with the MDR where you can have 45 minutes of looking at a light bar. IEMT is very different to that. It's about what's the fewest amount of eye movements we can actually do. So I don't think it can cause vertigo, but I might be wrong. If you're working with a client who has vertigo, do a test with them and it seems to aggravate it, IEMT is not for them. But I don't know of any link between vertigo and eye movements. I don't have any experience of that. If anybody else in the community has, please put it below, but I've not experienced that myself. Would like to approach identity piece for women that's struggling with empty nest, used to look after their kids, but maybe now they don't have a purpose. Again, so this is a broad brushstroke. Once again, I want to work with women and to every woman who has empty nest syndrome. For those who don't know, that means when your children have gone off to university or left home. This is going to be less frequent going forward because children don't seem to leave home anymore. So it's how do we deal with this? Well, again, every person's different. So I've worked with people who have had empty nest syndrome, and also people who've been through divorce and stuff like that. So I've got to ask the person, what's the problem? What's the problem? Now, first of all, I've got to state, being sad that your children or husband or wife or whoever's left home is perfectly normal and natural. We don't have to desensitize people from these emotions where it's a normal process, okay? We're not trying to dehumanize people, as it were. So with this, if somebody comes to me, let's say a woman comes to me, because I think it was specifically about a woman. She goes, I've got empty nest syndrome. Okay, what's the problem? I am so lonely. I feel like I have no point in life. I would write down what they're saying. I'd actually write down the things that they're saying right now. I feel so lonely. I have no purpose. Okay, I'd work on the kinesthetics, this feeling of lonely. How strong, how familiar. This eye that's lonely. Where is this eye? How old is this eye? What's going on around this eye? You could do a full IEMT, I, me, self, you, from who the person is now. Without them, I am nothing. Okay, brilliant, right? Write all this down. So these are the things which I'd be looking for. How is this individual person explaining the structure of their problem? That's where you want to start. How is this person explaining this in a linguistic form of how they're experiencing these problems? And I would work from there. If you give me more specific details, I can give you a more specific answer. But at the moment, that's all I can really say, because everybody's different when it comes to empty nest syndrome. But basically, what's the problem? My children have gone. I know. So what's the problem? I have nothing to do. You know this I that has nothing to do. Where is this I? How old's this I? What's going on around this I? And then what I'd be to look to do as well is to help them to create a new life of purpose. So, oh, sorry. So, what do you want to now do? Now you have this free time. What's it you actually want to do? And I've actually helped them to try and create a new sort of social life. Just get through these last ones so I can keep under 20 minutes. I've got the empty nest one twice there. What's your thoughts of identity of people speaking about themselves by name? I told myself, Claire, just sort it out. Okay. And then somebody put, I want to know the answer to this. I'm curious to know the answer. This was somebody else. I call myself by a nickname that only I use. Okay, so there's some real good stuff that we can do here. So Claire, you can do the identity of Claire itself, I suppose. What's the identity? People speaking about themselves by name. I told myself, those are the things which I'd work on there. I told myself, just sort it out. Just sort it out. Sort what out? Just sort it out. So I would break those things down. And what's the consequence of not sorting it out? What are they avoiding as well? So I'd look for some kinesthetics. So yeah, so I would write down the problem and I'd look at where can I use the identity of the proactive and the reactive, or the proactive and the passive. It's what Andy was teaching on his last course. Actually, it gets a bit deeper. I'm not going to go into it because it's too complex for this. But I would look at the identities of I, myself, and you that they're using. You can actually look at this Claire. Where is this Claire? How old is this Claire? What's going on around this Claire? You could certainly try that. And if you have a nickname that you only use for yourself, okay. So just say you call yourself Daft Cow or something, okay. And when's the first time you can remember being this way? I use this name for myself. Brilliant. This I, this me, this self. And then, so yeah. So again, like with everything, I'd write down the problem that they are experiencing. I would then look at what's kinesthetics to depotentiate, and then which identities am I then going to work on. So what are the kinesthetics I'm going to do first, and then what's left of the identity, which I can then do. Cool. All right, guys. I hope that's been of some help. If you have any questions, please put them below and I'll get to them next week. So next week is going to be Tuesday once again, and I will see you all soon.